Okay, good morning, everybody. It is 10:55, so I'm going to make a start because I know we're sharing this time slot with Paul Featonby, so we don't want to eat into anybody else's time. My name's Jane Kingston, and I manage the Advocacy Service in Connected Voice. We are a charity based in the northeast of England, and we support the voluntary and community sector and individuals. I have a PowerPoint presentation, so I'm going to now attempt to share my screen with you all. Can I get some indication from someone in the team that that's working? Thank you very much. Okay. So today's presentation is titled Innovating in a Crisis, Providing People with a Voice Through DIY Advocate App. And for those of you who are new to the work we do in advocacy, I'm going to give an overview of what that is, some of the challenges that we found working through the pandemic, to talk about how we have integrated technology into the advocacy sector, and more importantly, share with you around the app that we've developed. So first of all, just a little background into advocacy. In a nutshell, advocacy, we say, is about making sure that people are heard, that their voices are amplified, and that people really are able to say what they want in their service provision. We also make sure that we take a rights-based approach and that people's rights are upheld in any situation. And we are there to make sure that people have access to the services that they need. Advocacy is a social justice movement, and it's very much about promoting social inclusion, equality, and social justice. Whilst the sector itself isn't regulated, there are many quality frameworks that we work towards. And as an advocacy organisation, we work to the National Advocacy Charter. We are overseen by a quality performance framework. Our advocates are all trained to national, city and guilds level. And we work within the Advocacy Code of Practice. And we're really proud to say that we were awarded the Outstanding Advocacy Award nationally in 2018. So currently we provide a range of different services as we're funded across the Northeast. Predominantly our main contracts are around providing health and social care advocacy. So people who have any issues around health and social care, but are either in a vulnerable position or unable to have their voice heard due to perhaps a disability or the situation that they're currently in. We provide advocacy under the legal frameworks of the Mental Capacity Act, the Mental Health Act and the Care Act. We have specialisms around autism, and we provide this advocacy into the National Autistic Centre in Northgate Hospital in Morpeth. We have a current project to support victims of hate crime. We have funding to help families who are in financial crisis. And we respond to individual need. And we currently have contracts for people going through child protection hearings who need to have a voice in that legal setting, or personal injury rehabilitation advocacy. We really believe that the pandemic has brought about highlighted the need for advocacy and why it's so important. I'll touch on some of those reasons, but mainly it was because last year we found lots of myths around changes to legislation, changes to local authority provision around social care, and actually some myths around whether advocates were still operating and still available. So we had to make sure as a sector that we spoke out to explain that the legislation didn't change and that people still had a right to their services. A role around scrutiny, making sure that institutions that hold and restrict people were doing so lawfully. So for instance, that would be care homes and hospitals. We heard some awful horror stories about human rights breaches of people being locked in their rooms, unable to access the outdoors or see family or friends in any way. We've also commissioned some research this year, particularly around how the pandemic has been affecting the groups of people that we work with, making sure that people were still able to navigate the complex systems that they are trying to access services through, and making sure that they always had choice and control in what they were choosing, and that they had a good quality of life, even though there were the restrictions that we've all had to live through. We continue to support people through complaints processes and raising challenges, making sure that they are at the centre of all of their planning. And more importantly, access to crisis services. We've seen an increase in the need for food banks and homeless support during the pandemic, and doing welfare checks, because we've had a lot of people needing to access mental health, community mental health services who are in despair. And more importantly, making sure that people were safeguarded through this difficult period. So pre-pandemic, technology was on the fringes of advocacy. We were predominantly paper-based service. So technology for us meant having a mobile phone, maybe taking a tablet out with us to meetings, updating our notes when we were out on the outreach, and all of our data being stored in a content management system. And of course, using communication aids with people who were unable to communicate verbally. But since the pandemic, we've taken huge leaps. We are now conducting hearings and meetings through remote virtual access, so video conferences. We now see our clients over video calls and have learned to use the technology better with our service users and adapt to that. And of course, our app really has found its place during the pandemic. So onto the story of DIY advocacy. So 6 years ago, we were awarded some funding from North Star Ventures Fresh Ideas Fund. This was to help the organisation become more able to generate some income, so create a product that we could sell. So the next year was really focused on us looking at what we needed the app to do and what it needed to look like, and commissioning somebody to build that for us who really understood what we needed. The next couple of years, we really focused on working with particularly the advocacy sector to see how it really worked with our service users, looking at sales, training people to use the app, and developing a workbook around self-advocacy to go with that. And we were proud that in that period, we were able to sell to other advocacy providers and a local health trust. But we did find that there were some issues with having an app that we didn't host, that we didn't control, and that we couldn't update quickly. We were reliant on an external party to do that for us. So with the help from the Innovation Super Network Northeast Fund, which I know they're here today presenting, we were able to rebuild the app to make all the improvements that we wanted and bring it into our organisation. So we have autonomy. We have cost savings, we can adapt things really quickly, and we're able to rebuild that for other customers. Oops, excuse me, if we go back to that one. There we go. So the app was born from us identifying problems that we had within our service and thinking that the app could provide some solutions, which I just want to run through with you. So the first one, when working with individuals in a case management style, we found that the app really helped us with the throughput of the cases that we work with. For issues around triaging new clients who come to the service, new referrals, this was a way of being able to offer alternatives whilst somebody was waiting for an advocate. And where we had waiting lists, this was able to cut down on frustrations people felt of waiting. It also helped with the endings to move away from dependency on individuals working with an advocate. We were able to find a really strong way of bringing that relationship to an end and helping people to self-advocate. We also found that it helped with any perceived power imbalance that might be happening with a client and a support worker or advocate. So really, this is all about helping somebody to speak for themselves and identify their own solutions. Advocates obviously work around the 9-to-5 model, Monday to Friday, and this app obviously is there for the person to use in any way, in any place, at any time. So it kind of reduces those limitations. And for some people who are finding perhaps lack of preparation or unable to prioritize what is the issue that they need to work on first, if they've got multiple issues, the app really helps to flag up which issues are serious. It will have safeguarding and protection information if somebody has a very serious issue, and it helps them to prioritize. We also found that sometimes information got lost in translation between 3 parties, and the app really helps to cut down on that because it's about the person saying their own words, writing them in their own action plan and sending them to the person that they want to meet with or have something happen for them. It also cuts down on the person having to tell their story too many times to multiple service providers. They have it written and they can send it to whoever they want and update as they feel. It cuts down on the problem of non-attendance of appointments and meetings because the preparation work is done in advance. The service provider that they're meeting with knows about what the person needs or wants from the session, so it can make the meetings and appointments much more efficient. In terms of introducing technology to the advocacy service, we found that it's really helped with efficiencies and cost savings, that we're able to reach more people than we could with just working face-to-face with staff. There are no criteria barriers that we find with our current funding of projects, and that the resources within the app means that the individual has a range of multiple tailored resources to help them. As I mentioned, it's accessible at any time for them, and they really own their own action plan. And it simplifies sending data to third parties. As highlighted in the session prior to this, there is the issue of digital exclusion, and the app is not a solution for everybody. And we are very aware that we have particular service users where this is just not an option. And obviously it's limited to access to the internet, access to devices, and it certainly isn't going to support people directly to make disclosures around safeguarding, but it's a step in the right direction and helps people to alert them to when there are issues and where they can get immediate support. If you were wondering about adapting this app for yourself in your own organisation, we believe that this is a really good opportunity for you because it's an affordable way to start introducing technology into your service. As I said, we've gone through the painful bit already, so you don't have to. We've kind of ironed out most of the glitches, and the template is there ready to be adapted for you. We believe that this version has been based on user feedback, and we've really looked at accessibility issues within it, and we believe that we really understand client-focused work and that this helps take you through that journey with your client, but you can have bespoke versions. And we also believe that we have really useful customer feedback, and we will continue to adapt this to the needs of our service users and commissioners. I'm now going to hand across to my colleague Sally, who will talk a bit more about the options of purchasing the app for yourself.
Thank you, Jane. I hope that you can all hear me. Could get a thumbs up, Jane, thanks. So we have a number of different options for purchasing the app, depending on how much you want to customize it, if you want to host it yourselves. So you can start by purchasing a subscription to the app. So that means that you'll get your own URL and you'll be able to get your service users to subscribe to the app and send information, send reports directly to you. A step up from that is a fully customized version of the app. So that means that you can add your own brand, you can adapt the resources and include your own resources as well. And also it's you can change the questions on the decision tree. So that means that you can look at what sort of journey the users that you work with are going to use it for and make sure that the questions are appropriate for that. We have another option where you can actually purchase the app and then host it yourselves. So this is for if you want to host it on your own server and have complete ownership of it. We'll take you through the first year of that. So get it all set up. It'll be fully customized. So it'll have your own questions, your own resources, your own branding. And after the first year, we then hand it over to you. So there's a few different options, and that depends on how much you want to customize it, how much ownership you want over it, and also obviously your budget as well. So if you've got any questions at all, please do drop them into the Q&A or into the chat, and we'll be more than happy to help with that.
Thank you, Sally. I think that brings us to the end of our time. So I am now going to hand across to Paul Featonby from Tharsus, who's going to tell us all about the bump.
Thanks, Jane. Yeah, so it's fascinating, all the different, the huge range of things that are going on in the Northeast, and yeah, what diversity there is. Yeah, not only in people but yeah, thank you. I'm also going to talk about innovating in a crisis and some of the things that we've done, particularly over the last year, and some of the things that we've taken away from that in terms of how we actually engineer success and what we can take forward to future innovation and future products. Just need to move on. Yeah, so just before I get into the details of Bump and what it is and what we did, I just want to cast our minds back a year or so to March last year. So the virus, as I'm sure you remember, was taking hold in Western Europe. Italy and France were 2 or 3 weeks ahead of us. We could see cases rising exponentially, and it was quite a frightening time. There was a lot going on, and there was panic, there was confusion, there was new vocabulary, furloughing, social distancing, R numbers, lockdowns. But as a number of people alluded to in the introductory sessions, it was also a time of kind of coming together and community and shared purpose, people wanting to do good and reduce the impact of the virus and indeed reduce deaths. And yeah, we too were in that category, both as individuals and as a company, in terms of, we wanted to do our bit and do all that we could to help. You'll remember that there was a lot of activity around ventilators, and these were, seen as critical in terms of keeping people alive and reducing. This is a photo from JCB for some of the things that they did, but there was a lot of other activity, including a number of people in the region. We looked at this, but we concluded it was well covered. There were a lot of people on the case, and indeed people much better placed than us to solve these problems. However, what we very quickly realized was social distancing was really critical to keeping people safe and keeping business working. So you remember when the first lockdown came, the government said, work from home if you can. I and my team, most of what we do is write software, so we were able to work from home. But this is a photo of some of my colleagues in the warehouse. These guys were not able to work from home. So the people in the warehouse, the people building the robots and doing kind of what is a day job to build machines and robots, they had to be at work. And we wanted to keep them safe and to keep the business working. Sorry, direction. Yeah, social distancing is hard. So things have changed a bit over the last year, but I'm sure you'll remember, a year ago, if you were stood 2 meters away from somebody trying to have a conversation, it felt rude. It certainly wasn't natural. And we started off playing with, 2 meter long sticks to try and keep people apart and keep them safe. We joked about 6-foot sombreros and yeah, you can see this photo from Burger King, but it's not very practical in the work environment. And so we knew we needed a better solution so that we could keep people at work and keep them safe. And out of this, the concept of Bump, of what we call Bump, was born. So you can see there on the photo, 2 devices. I've got my device here. I'm at home today, but this is the one I wear when I go into work. And basically, it's a device to, as it says there, help keep people safe by encouraging social distancing. So the way it works briefly is if a device comes within 2 meters of another device, it beeps and flashes just to warn you, give you that little prod, little nudge. Oh, got a bit close, move apart. If you do ignore that and get within 1 meter of somebody, then it'll beep continuously at you and flash red to tell you to hurry up and get apart. So I want to, I'll come back to some more of the technicalities, but I just want to go through some of the things that actually led to the success of this and what we did. The first thing is around purpose, and it was really clear. So at the high level, the purpose was there. We wanted to keep people safe. We wanted to save lives, and we wanted to save livelihoods. And, nobody disputed that. Everybody was behind it. Everybody understood that. But also at a lower level, the purpose was clear. So when I say at a lower level, I mean kind of the specification, the what did we actually want to do. So yeah, we wanted a device that would encourage social distancing, that would prod people, nudge them, and therefore help keep them safe, save lives, save livelihoods. And the fact that everyone just understood this, you could articulate it in a sentence. It wasn't a 50-page specification document with what we were trying to do. It was really, really clear, and people could get behind that. In terms of the team, so yeah, at Tharsus, I'm really privileged to work with a great bunch of people. And this is a photo on our shop floor of some of the people who were involved in Bump. And yeah, we're a great team at Tharsus, but equally, we knew that we didn't know everything, and we didn't have all of the resource and kind of skill set we needed to develop. So we recognized that, and we brought in a number of people from the region and beyond to help develop the product and deliver it. And just coming back to the purpose, it was really easy to do that because, as I've said, people wanted to help. We knew what we were trying to achieve. It was really easy to articulate. And so we brought a number of people in, our own, help do this. The technology was harder than we envisaged. So we'd done a number of things back in 2019 around motion tracking, distance measurement, and various things in that space. So we weren't quite going from a standing start, but what we ended up developing was very, very different from what we started with that we'd done back in 2019. Just to give you an example on some of the technicalities. So if we have two devices that are talking to each other and ranging, so they send a radio signal, and from that we do a bit of maths and can work out the distance, and then decide whether we flash the blue lights or the red lights. If there's two devices, it's relatively simple to do. But if you've got 100 devices in the room, or several hundred, as we do in reality, the deciding which device you're going to range with and doing that quickly because we want them to respond, within a second, doing it accurately because we want centimeter type level distance measurement, and doing it without was a really, really hard challenge. And fortunate to have a number of people in the team who did some pretty sophisticated modeling on that to allow us to get a solution. But also, as I've put at the bottom there, sprint hard and fail fast. So the concept of sprints is understood in software development. It's a little bit different in product development and works a bit differently. But the ability to fail fast was also really important. So we were fortunate that we had several hundred people on the shop floor who we could test with and who we could learn from, learn how the device worked, learn how they used the device, how they interacted with it, and very quickly modify to get something that worked. So we went from a pretty much standing start back in March, kind of Easter time, to something that was up and working within 3 months. And there were various upgrades, software updates and things that came beyond that, but we went very, very quickly. And yeah, as Charlie puts in the chat there, the test bed to really test quickly was really, really important to the success. Just in terms of the tech behind it, for those of you listening and interested in that, so the device itself uses various radio communications to range with the other devices. We have hubs around the factory and around our customer sites that take the data off the devices. So these are an Android tablet with an Android app on them. They Bluetooth to the device to pull the data off, and then cloud. There's various databases in the cloud that we use Azure to manage. And then there's a front end that allows users and administrators to log in, look at your data, look at who you're interacting with, and manage hubs and devices and things. And I'll show a couple of screenshots in a moment. Just before I come to that, one thing that was really important from the start was around what we call data democracy. So by data democracy, what I mean is we didn't want it to be a big brother device. We didn't want it to be something that was spying on people or something where managers had different data or different information to the users. So this is a photo of some of my colleagues at work, obviously standing, having a socially, but the information that the device actually collects is only the information that the users see. So if I interact with somebody and my device beeps, all that I'm recording is, yeah, I interacted with that person. I know who that person is because it's one of my colleagues, when I interacted and for how long. And we made sure from the start that it was really clear that that is all that's collected, and the users can log in and see exactly the same information as the administrators of the system. And this was really important for engagement, acceptance, advocacy, so that people understood it was absolutely about keeping them safe, not about spying on them and tracking what was going on and where they were in the factory and various things like that. This is just quickly a screenshot of my dashboard. So I can log into the system as a user and see how many interactions. So here, yeah, in the last 7 days, 2 red bumps, which is good because I've listened to the blue ones, and 92 blue bumps. And for how long? I can then click through and see who I've actually been interacting with. So that allows 2 things. So the first is actually it allows me, if I'm working too closely with people, to adjust the setup and what I'm doing. But the other thing that it's allowed us to do, which wasn't an original aim of the project, is to get really accurate instant track and trace data. So just as an example, so actually one of the guys at work tested positive for COVID just yesterday. And we were able to go into the system, instantly see who he'd been interacting with. So the government guidelines are if you've spent more than a minute less than a meter away from somebody, or more than 15 minutes less than 2 meters away from somebody, and they test positive, then you should isolate. The guy yesterday, there were 2 other people who fell into that category because of who he'd been working with. We were able to instantly get them off site to isolate and test yesterday, and therefore potentially stop any additional transmission. And yeah, we've been very fortunate at Tharsus. So we've had we have had a number of people who've tested positive for COVID, but we know from the data that we've had no transmission at work, and bump has been a big part of that. Just before I finish, can't help but talk about the London Marathon and show some photos of some famous people wearing bumps. So again, yeah, if you cast your minds back to kind of Easter, springtime last year, you'll remember that all of sport stopped, and well, we as people, as spectators, but equally the people participating were keen that that happened. So we engaged with the London Marathon to help put on the elite event that happened in autumn last year. We embedded ourselves in the hotel with the athletes, with their entourage, and with the people who were setting up the event. They all wore bumps so that they could help keep themselves safe and help distance, as things were being prepared and as things were set up. This is a photo of, I don't know if you recognize him behind the face mask, but of Eliud Kipchoge, who's the fastest marathon runner in the world, wearing one of the bumps at the team hotel. And yeah, out of that, we were fortunate that there was a bunch of good publicity. So the BBC website, we got on the Forbes website, in the Times with the photo that you've just seen, and even made the BBC's evening coronavirus update in at number 5 with a picture of bump. So yeah, just kind of our takeaways from that. It was a fascinating journey. It was a great time to be able to do something good. But 3 things that were really important in terms of the success of what we did, and probably in order here. Number 1, we had a really clear purpose. There was a really clear kind of vision, mission that people were behind in terms of keeping people safe, saving lives, saving livelihoods, and then a really clear kind of specification purpose in terms of what we were trying to do in terms of encourage social distancing. We had a great team. So as I've said, we had a great team of people at Tharsus, but we recognized we didn't know everything. So we had a great wider team of collaborators who could help and produce this device and do it really quickly. And then, yeah, the sprinting hard, failing fast. We ran really hard at this. It was intense. It was hard. And with that, we had the test bed of our own, our own factory, our own colleagues to test on, to learn on, and to develop the device so that we could fail fast. So, yeah, hope you found that useful. I'm happy to answer any questions. Equally, happy to, if you want to get in touch directly, my email's there, or you can find me on LinkedIn. Yeah, equally, I know Jane and Sally moved on quite quickly before they had any questions. So, yeah, can bring them back in if anybody wants to ask anything to them as well. No more questions in the chat, so hope that was good for everybody, and yeah, look forward to seeing you in the other sessions.
Thanks everybody. Bye bye.